Have you ever been interested in oncology nursing? Or maybe you said oncology nursing is just not for you, even if you've never been an oncology nurse. Well, in this episode of the Nurse Converse podcast, we are going to talk about some truths about oncology nursing, dispel some myths. I'll tell you a little bit about my own personal journey in oncology, and we'll get into the Oncology Nursing Society and the 50th Annual ONS Congress that just took place in April of 2025. And for May, Oncology Nurses Month, we'll be able to share this special episode telling you all about the world of oncology nursing, how special the patients are, and the nurses that take care of them behind the scenes. My name is Rebeca Leon, and I also go by Enfermera Mami, aka Nurse Reb. I have a master's in nursing education and a nursing professional development board certification. I work as a nursing professional development specialist by day, but I work specifically in oncology nursing. And that is part of my nursing identity, is to be an oncology nurse. I fell into oncology nursing by pure happenstance. I never imagined myself being an oncology nurse. But like many of us in nursing, we have a special and personal connection to the parts of the profession that we are in. For me, that's no different. Oncology nursing is something I never imagined myself doing, but I'm so grateful that I fell into this part of the profession every single day. Between the innovations that we see in oncology nursing, the different specialties that you can be in, and the change and dynamic part of the work that we do every single day, I couldn't imagine being in another part of nursing. I'm so grateful and so excited to be able to call this my home. And I hope by the end of this episode, you will be able to either say that you're at least a little bit more interested in oncology nursing, or you might be able to share it with a friend who may be interested in looking into it for their own career path. I really want to welcome you to this episode, and I'm really excited for you to hear a little bit more about my journey, but also a little bit more about the Oncology Nursing Society. The Oncology Nursing Society this year makes 50 years of it being in existence, meaning that oncology only has about 5 decades worth of innovative nursing experience. Now, that's not to say that there wasn't nursing happening in oncology prior to 1975. Oh no. This was just the year that nurses came together across the nation and wanted to create the foundation of a professional organization that could make change, not just for the patients that we serve, but also for the nurses, the providers, and everybody in between. Because oncology nursing is such a specialized field. With oncology nursing, it doesn't matter where in the care continuum your patient is. You will always connect with an oncology nurse. For me, that journey started in the outpatient setting. For many, it starts in the inpatient setting. It really just depends on what you're interested in and how you want to evolution your career. So oncology nursing, as I mentioned, is really part of all of the care continuum for nurses and for the patients that we serve. You can be an oncology nurse in the inpatient setting, whether that is on a specialized disease unit floor, like an oncology floor or bone marrow transplant. Or maybe you are in radiation oncology and you work on the inpatient side. Or you even work in interventional radiology, but you specialize in interventional oncology. There are so many different ways to be an oncology nurse in the inpatient setting. Just like there are so many ways to be an oncology nurse in the outpatient setting. You can work as an oncology staff nurse in the clinic, a chemotherapy infusion nurse. You can work as a radiation oncology nurse in an outpatient setting too. Or even more specialized like surgical oncology or BMT. There are so many ways to be involved in oncology and to take care of these different patients. In my work setting, I've worked in the outpatient setting for oncology as a clinic nurse for gastrointestinal cancers specifically, which was really getting back to my nursing roots because my first set of patients, surprisingly enough, were those GI oncology patients, but I saw them in the surgical setting. So I didn't realize that I was an oncology nurse since the beginning of my nursing career. Just like many of us, taking care of oncology patients without even knowing it in other parts of the care continuum. That's what makes oncology nursing so special. That regardless of where you are, whether in the hospital or on the outpatient side, you may be taking care of oncology patients and have to provide that specialized care. There's a lot of skills needed in oncology nursing, whether they're technical skills like being able to safely administer chemotherapies, whether it's safely being able to support our patients in radiation oncology, which is a specialized field all by itself. And kudos to my rad-onc nurses because they live in a totally different world of oncology. And I love the work that they do. Or if you're working as a surgical oncology nurse and supporting patients that way. There are so many technical skills that you can develop in oncology nursing that you may not see in other areas. That also means that every place and space that you work in oncology, you're going to be learning new things, regardless of the setting. So if you want to develop your nursing skills, oncology is absolutely one of those places to do it. But we can't get away from the fact that in oncology nursing, regardless of the setting that you're in, there are a lot of soft skills that are needed too. And sometimes these soft skills can feel like they're even more important than the technical skills because our patients are an incredibly vulnerable patient population that need that support, that need those extra 5 minutes of care, that need somebody to lean on when they feel like they have no one or feel like they don't have any hope. Our nurses have to be that hope for those patients. We have to know all of the different therapies that they could potentially have. We have to know all of the different alternative therapies that we could provide them to make them more comfortable. We have to be able to talk to them in a way that doesn't make the scariest moments of their lives feel like the scariest moments of their lives. And that's why I will always respect oncology nurses. Because no matter what, the tenacity and resilience that oncology nurses have to exhibit every single day is truly unmatched. When I was at the conference this year, one of the questions that they asked us was how many people had heard that oncology nurses and oncology nursing was the place and space where we see a lot of patient death. Unfortunately, many of us raised our hands. And we talked about how many of us never envisioned ourselves being in oncology nursing because it is such a quote unquote depressing place to be for the nursing profession. But the thing is, that's only a part of it. The other part of it is seeing those same patients that may have been not doing so well get up to go to the end of the hall and ring that bell because they just received their last ever chemotherapy treatment or their last ever radiation therapy treatment. And the joy that you see and that you feel with those people is something totally unmatched. And I bring these up to say that as negative as some of the experiences can be for both our patients and our nurses in oncology, the joys and the highs are unmatched. Because there is nothing like being able to talk to these patients after seeing them in what feels like they're going through the trenches, but seeing them come across on the other side and really get to enjoy living life again. Or even throughout their treatments, seeing them experience life to their fullest because they know that unfortunately, they may not have too much longer to experience it. Being an oncology nurse is so special because you never know what you're going to get into that day. You're never going to know what type of patients you're going to see, how they're doing, and how they're feeling. But as their oncology nurse, you can always be their light. You can always give them hope. You can always give them love. And you can always support them, no matter what they're experiencing. And that's one of the things that's so special about being an oncology nurse. But that also means that oncology nurses need to take care of themselves. They have to be able to take care of each other and support each other. And in every setting that I've worked in as an oncology nurse, I have seen that firsthand, and I have experienced it firsthand. Oncology nurses will take care of each other like no other place and space I've ever been. They will also teach young nurses coming in about all of their little tips and tricks, because at the end of the day, patient care is at the center of it all. And in all of the places and spaces that I've worked in, nothing compares to the love and care oncology nurses have for their patients and for each other. And for that, I'm so grateful. But that doesn't mean that it doesn't come with challenges. And I think, especially being younger in the field of oncology nursing, I'm starting to see what that means and feel what that means. But at the end of the day, I don't think I would trade it for the world, because in oncology, I have seen the most growth in my career. I have also seen the most growth as myself, or in myself, as a person and as a nurse. So I'm excited to be able to continue my journey as an oncology nurse and see where this profession takes me, because I know that every single day there are going to be new therapies, new technologies, and new experiences, which is one of the great things about being part of the Oncology Nursing Society, is that the Oncology Nursing Society is going to keep you up to date on all of those changes, because when I tell you, it feels like every mile goes by in a minute with advances in technology, therapies, and even just the profession itself. It is hard to keep up. But that's part of what makes oncology so interesting to me, because no matter what, you know that there's going to be a breakthrough. You know that there's going to be research. You know that every single day we are taking a step to care for our patients better, which is just honestly so exciting. And it's also so great to see the work that nurses are able to put in to do those things. That's what made going to the 50th Annual Oncology Nursing Society Congress so special to me. I was able to attend for the very first time this year. And part of the reason why I attended was because I was able to submit an abstract on some of the work that I did this past year with my healthcare system, and actually have a poster presentation, which was a really cool experience. And I'm going to put in a quick plug and tell you that everything that you do in your profession, if it is applicable, write an abstract. Write it, submit it to your professional organization. Get that work out there, because as nurses, we are doing some incredible work, and we have to be able to document it and share it, because that is what makes our profession so great. And that is what advances us every single day. So go out there and get that recognition for the work that you are already doing, because I can guarantee you that somebody is going to want to hear all about it. That was one of the really cool experiences I had, because I was able to submit that abstract and become a poster presenter. I also decided that I would submit myself for the Oncology Nursing Foundation ONS scholarship. And lo and behold, I was able to receive that scholarship, which facilitated my means to the conference. Now, this scholarship didn't cover absolutely everything, but it did definitely cover my conference fee and my hotel to stay there, which I was incredibly grateful for, because for many of us, that is a barrier in attending conferences. Because I recognize that it is a privilege to be able to attend a conference, because many of us do not have the funds to necessarily put aside and go to these professional conferences, especially those that happen multiple times a year. But I do recommend for anybody that is interested in attending a conference for a professional organization, not only should you submit an abstract, but you should also submit to see if you can receive funds from a scholarship for them. Because many of our organizations do, in fact, submit for scholarships for nurses to facilitate their way there. So those are my two quick little plugs. I do highly recommend that if you are a part of a professional organization, go ahead and attend their conference, because the experience will absolutely be invaluable. I know it was for me. And I'm so excited to be able to pay that forward by also donating to the Oncology Nursing Fund. Because their scholarship meant so much to me in my experience, I wanted to be able to pay that forward for others. So this year, the 50th Annual Oncology Nursing Society Congress was themed Celebrating Yesterday, Transforming Tomorrow. And really, it was to highlight the 5 decades of oncology nursing. Because let's be honest, oncology nursing in the last 5 decades has seen a lot of changes and seen a lot of growth in the profession. They mentioned how at the very first Oncology Nursing Society Congress, they only had 200 attendees, whereas this year we had over 4,000 attendees, which is incredible. But this conference isn't just for those that submit abstracts or submit for speaking sessions. This conference is really for anybody and everybody. You can be a registered nurse, a licensed practical nurse, or you can either be a nurse practitioner, an RN, BSN. It doesn't really matter what level of nursing you are, whether it's leadership or education. This conference is for you, because being an oncology nurse over the last 5 decades has evolved and changed so much. And the Oncology Nursing Society has truly kept up with the times and made a way for oncology nurses to celebrate their wins, talk about the losses, and support one another every single step along the way. We had some really incredible keynote speakers that talked about changes in the profession, new therapies, gave us history lessons, and we even started the conference by hearing stories of nurses from every single one of those 5 decades. We heard a story from one of the original founders of the Oncology Nursing Society, and it's such a blessing to be able to still have them around and hear directly from them what the profession was like 5 decades ago. We got to hear an incredible story about a nurse that just became an oncology nurse, and she spoke on just how much the profession has impacted her in such a short period of time. But then we also got to choose what our conference experience was going to be like. We got to pick whether or not we wanted to hear about the latest and innovative research. We got to hear about educational strategies. We got to hear about what the profession is really like in the nitty-gritty, and the work that everyday nurses like you and I do for advancing the oncology nursing profession. So it was really such an incredible experience to be able to customize a conference for my interest and for my learning needs. As a nursing professional development specialist, of course, I went to some of those educational sessions. But I also went to some of the other sessions to learn more about our specialty. Because I know, especially as a nurse in oncology for only the last 3 years, I still have a lot to learn. And being in this conference really facilitated that learning for me. We were also able to get access to the presentations and get to do some of these CEUs later on down the line, which I really appreciated because it really meant that I could make the conference what I wanted to make it. There was also an incredible space called the Learning Hall, where not only did they have vendors supporting the oncology nursing specialty, but they also had places and spaces for nurses to have facilitated discussions about different topics that matter to us in our day to day work. They also even had a little history area where they brought oncology nursing history to life. And it was such an incredible space to be. In one of those moments when I was walking through the learning hall, I even had the opportunity to speak to the outgoing CEO of the Oncology Nursing Society. And I asked her what she wanted to share with the world about oncology nursing. And really, her message was pretty clear. Oncology nursing and the Oncology Nursing Society specifically are here to support nurses, are here to support patients, and are here to support all of our providers. Anybody that is part of the oncology nursing specialty can find support in the Oncology Nursing Society. And we really are here to celebrate yesterday and transform tomorrow because we never know what tomorrow will bring. And we know all of the changes and innovation that have happened, even just in the last 50 years, even just in the last year. So it'll be really incredible to see where the oncology nursing specialty happens to go in the next 50 years. And they know that ONS will be there to support the specialty as the premier oncology nursing professional organization. And they do that not just in supporting and researching, but in really equipping nurses to be the best that they can be. The Oncology Nursing Society also has the certified the Oncology Nurses Certification Corps, which supports nurses being able to become experts in their space by either being part of the Oncology Certified Nurses certification, which I hope to take this year, or even for pediatric nurses. Regardless of the area of oncology nursing that you want to be a part of, I'm sure there is a certification for that. And they make sure that nurses are fully equipped to take this exam and excel because we have to have that specialized knowledge to be able to support these patients. Some of the hot topics of the conference were immunotherapy, diversity, equity, and inclusion in cancer care, nurse-led research, and even there was some talk about AI in nursing, which was really interesting, especially because that's where we are moving to, not just in nursing, but in the world. There were also many emotional movements, like being part of the Extraordinary Healers Awards dinner, where they highlighted the work of an oncology nurse who is making care accessible for Chinese and Cantonese patients in California, which was such an incredible story to hear. Or having my own employer win the Employer Recognition Award because of our efforts in increasing the number of certified oncology nurses, which was really special because that's part of the work that I get to do, and we all got celebrated for it. And really just honoring pioneers in oncology nursing every step of the way because all of us are pioneers in oncology nursing. If you take on a project, if you make change, or do something that supports your patients and patient care, you are a pioneer in oncology nursing. So we have to be able to celebrate it as such. But it's really interesting to see where the oncology nursing profession will go and how it's impacting the nurse's role, especially because many of these therapies and many of the advancements that are happening are not only happening in the inpatient setting, but they're also coming to the outpatient setting. Things like CAR T cell therapy, which is a form of immunotherapy where a patient's own T cells are genetically modified to better recognize and kill cancer cells. This is typically used in blood cancers like leukemia and lymphoma, but it's changing the landscape of oncology nursing. We have things such as precision medicine with genomic profiling, which is using genetic testing of tumors to create personalized cancer treatments that target specific mutations, like the BRCA mutation in breast cancer. We have things happening like artificial intelligence in oncology with AI tools assisting with early cancer detection and predicting patient outcomes more and more accurately every single day. We have things like liquid biopsies, which are non-invasive blood tests that detect cancer DNA fragments circulating in the blood, and that's helpful for early detection and monitoring treatment response or detecting recurrence. So all of these things combined are affecting the way that inpatient and outpatient nurses take care of oncology nursing patients. We also have advancements in radiation oncology, such as proton therapy, which is a highly targeted form of radiation therapy that spares healthy tissue better than traditional radiation. And it's used for tumors in near critical structures such as the brain, eyes, or the spine. And even for the outpatient nurses taking care of these folks, we have things like wearable health tech, like devices like smartwatches or biosensors that are used to monitor cancer patients' vital signs, treatment side effects, and even the physical activity remotely. And speaking of the remote world, of course, we have to get into technology like teleoncology, which is providing cancer care, consultations, follow up, symptom management through telehealth platforms, which is expanding access for our patients, especially those in the rural patient care areas. Really, oncology nursing and its advancements are focused on patient centered care and survivorship, increasing the need for research nurses and nurse navigators to provide patients the care that we need, and highlighting the importance of self care for our patients, but also for our nurses, and highlighting the importance of mental health care for our patients and our nurses. Because this profession is a tough one. Nursing as a profession is tough, but oncology nursing as specialty is tough to work in and requires that additional level of support. So, whether or not you are currently an oncology nurse or you're interested in the profession, I highly recommend being able to seek out care as you are needing it and able to, because it will make a world of a difference. If you are taken care of, your patients will be too. Now, for anybody that's interested in oncology nursing, there's many different ways to get involved. You can start on the inpatient setting, like I mentioned, or on the outpatient setting. But anybody that is interested in oncology nursing, I recommend going and shadowing in the particular area that you're interested in, because I promise you, it may not be anything like you imagined. I know for myself, especially when I came to the outpatient setting in oncology nursing, I always tell my new staff members that it is using a totally different part of your nursing brain. Whether it's working in the clinical area where you have patients coming in who have complex disease and complex treatments, or having to triage symptom management, it is totally different than anything I have experienced in nursing, and let alone working in the infusion area. While many of us as nurses are used to being able to infuse our patients with drugs or fluids, chemotherapy and infusion is a totally different beast. So, if you are interested in oncology nursing, I highly recommend going and shadowing on a unit before you even take that interview. Or if you do take that interview, go ahead and ask them for that shadowing experience. I promise it will be incredibly valuable to making that decision and taking that next step. And that especially goes for my nursing students. If any of you ever have the chance to shadow or have a clinical setting in an oncology area, please take that experience. I love having nursing students in our oncology areas, especially in the building that I particularly work in, because we work in a care community where all of the care for the patient is happening in the same place and space. So the same room that the doctor's visit happens in is the same room that the patient gets their infusion in. and it is truly a unique setting. I love having our nursing students come and do their clinicals in the oncology setting because they're able to see something unlike they've ever witnessed before. Another way to get involved in oncology nursing if you're not quite ready to take the plunge and work in our area is joining ONS and joining the local chapters. You can absolutely stay abreast of all of the new information that is happening in your local areas by joining the local chapters for ONS. They do such great work and are able to connect people in oncology across hospital systems and do a lot of really amazing things with the patient populations and with the nurses in those local chapters. ONS also has a lot of really amazing resources, such as the Oncology Nursing Congress, but they also have a virtual conference called ONS Bridge. So if you're interested in the oncology nursing specialty, I highly recommend attending. It's a virtual conference that is an abbreviated version of ONS Congress, where they will present a lot of really great advances, but also connect people for that personal touch. It's also really important to continue your education. I know for myself, oncology nursing is still a really big beast, and I will be the first to tell you that I know nothing about capital O oncology. And the reason why I say that is because there is so much to learn. I know things about oncology, of course, working as an oncology nurse, but there's always something new. Whether it's a new infusion type of treatment or a new type of radiation oncology procedure, there's always something to learn, and I am definitely still learning. But that's part of what makes this specialty so fun, is that there is always something to learn. And you have the resources really at your fingertips, especially with ONS and the American Cancer Society. Those are some really great resources. And once you kind of are able to get a hold of all of those resources and learn for yourself, you can always get a certification. And that's one of my personal goals for this year. So if you are interested in advancing your oncology nursing journey, I highly recommend starting there. And even attending ONS Congress at some point in the future, even if you are not officially an oncology nurse, it is a great experience to get that exposure and see all of the different places and spaces where oncology nursing happens. Because in the learning hall, they had employers that were looking for nurses just like you and me to go work in these places and spaces. And you're able to talk not only to their recruiters, but also to nurses that work in those places and spaces. So, all in all, I really just wanted to share some of the really exciting things happening in oncology nursing and tell you a little bit about the conference and tell you a little bit about my personal oncology nursing journey. I hope that you were able to see how much there is in oncology nursing, and if there is anything that you are particularly interested in, I highly recommend learning more about the Oncology Nursing Society and attending one of the conferences. It was such a special experience, and I know I will absolutely be going back. My call to action to all of you is connect with the oncology nursing community and check out the Oncology Nursing Society resources, but also consider being a part of the specialty. As I mentioned earlier, no matter where you are in the care continuum, you are more than likely taking care of an oncology patient, which makes you an oncology nurse. So, why not delve more deep into the specialty? I want to thank you all for joining for this podcast episode. I really love oncology nursing. It is absolutely a passion of mine. And I hope that I was able to impart a little bit of knowledge for you and give you a more specific look into what oncology nursing can be and what it is. I know for me, it has been so impactful to be an oncology nurse, and I couldn't imagine being in another specialty. Trust me, I've been in multiple of them, but oncology, at least in this point, is my home. If you found this episode helpful, please rate and review the podcast, and it will personally help me grow as a nurse podcaster and help Nurse.org reach more listeners. And share it with a friend who could use this information. Please be sure to go ahead and follow the Oncology Nursing Society So you can get more information about things such as the clinical journals, the Oncology Nursing Society podcast, webinars, and other educational resources, because there are plenty, and it is an incredible resource for all of us. And also, of course, follow the Nurse.org for more episodes of the Nurse Converse podcast, as well as more up-to-date information about nursing in general. And of course, follow me at InfedMedamamiRN on all major platforms. I am happy to share more about the oncology nursing specialty, nursing professional development, and guiding your career path. Because at the end of the day, that's what I'm passionate about. Thank you so much for joining, and I really appreciate you listening.